I've got some questions about Metformin used in people with type 2 diabetes, and that being used as an adjunct to the low-carb diet. So if someone would like to speak to that, perhaps explain what Metformin is, what its role is in the body, and whether it's safe to use in conjunction with low-carb.
So Metformin falls into a class of drug called a biguanide. There's only a couple of them. It's really the only one that we commonly use in practice. It's very effective. When I look at the literature on medications used in diabetes and all-cause mortality, that is, if I give you this drug, are you going to die more or are you going to die less? Metformin is the only one that makes you die less. Now, a lot of people are going to be surprised at this. If you have a look at what happens to all-cause mortality when a diabetic gets started on insulin, it goes up. And there's very good data. I think maybe at the next conference we do here, I might present some of this data there. It's incredibly fascinating to me. So Metformin, because of that profile that it actually is the one that does improve sensitivity to insulin and improves mortality, I prescribe it quite frequently to my patients. It does have potential side effects, the most common ones being nausea, diarrhoea and gastric effects, but usually they're quite well tolerated. We start people on a low dose and we can up-titrate it to a level that they tolerate as. But in effect, it actually does lead to a modest reduction in blood sugar. It does improve the sensitivity to insulin, and it's been shown to be beneficial, and it's the one formal medication which I will prescribe quite regularly.
And a friend of mine who's a professor of orthopaedic surgery also has researched it extensively and said that, number one, it's very helpful because it has some appetite suppression associated with it, and there is, according to him, not according to me, some improvements in having less likelihood of developing cancer with taking metformin. So he's chosen to take it to help him with a little bit of weight loss and with some cancer risk. But that's personal communication, not medical advice.
Is there a role for Metformin in obesity or somebody with...
Well, absolutely. So what's just been mentioned there is the diagnostic criteria, one of the diagnostic criteria for metabolic syndrome, abdominal obesity. So the criteria we use in Australia is 80 centimetres for females, 94 centimetres for males. So one of the actions of metformin is to improve insulin sensitivity, and abdominal obesity is a feature of insulin resistance. So it really makes good sense that that would not be unreasonable prescribing, in my view.
But probably the person should be investigated rather than just have the measurement and...
Oh, absolutely.
We'll just...
Often.